Hello, everyone, and welcome to the first webinar hosted by India Behavioural Economics Network on behaving ourselves, behavioural science response to COVID-19 in India. Firstly, thank you so much for such an overwhelming response to this initiative and for taking the time out to be here with us today. For those of you who are new to IBEN, we are a registered organization and community for anyone interested in behavioural economics and its applications in India. The objective here is to advance the incorporation of behavioral economics in academia, policy, and industry. You can follow us on Facebook, LinkedIn, and Twitter to find out more. And get in touch with us at indiabenetwork@gmail.com for collaborations, conversations, questions, or any concerns you may have. Our knowledge partner this evening is Behavioural Innovation Network, an innovation and impact firm. Vihara is dedicated to supporting innovations that enhance human health, well-being, and equality under the unfolding horizon of technology and climate change. Before we begin, I'd just like to briefly mention some housekeeping rules for everybody. All the participants are muted on the webinar. Please ensure your speakers and audio are connected for a seamless experience. We've put together a poll before we get started on some questions that we'd like your input on. I think Genevieve is going to share the poll just about now. And don't worry, you can answer the poll as and when you want. You don't have to answer it immediately. I think you can see it on the Zoom bar in the bottom. And please feel free to answer it throughout the webinar whenever you feel like. So this evening, we've got four amazing speakers. Ram Prasad from Final Mile, Sana, Behavioural Sciences from Dalberg, Varun Gauri, co-head of the Mind, Behaviour and Development Unit at World Bank, and Avnisha, assistant professor at University of Toronto. We'll have each speaker talk for about 15 minutes, giving us 25 minutes of question and answer towards the end. To ask questions, please use the Ask Question function on your screen. If your question is directed to a specific speaker, please mention that on your question. So let's get started without any further ado. First up, we have Ram. He is the co-founder of Final Mile Consulting. Ram built the company's practice on global health, sanitation, and safety. He now leads Final Mile's business in the United States. Ram has played a key role in building the practice of behavior architecture. Built on the precepts of behavioral economics and design, behavior architecture is a practice that explains and influences behavior in real-world settings. Over to you, Ram.
Hi, everyone. I'm glad to be here. If you have not already overdosed on COVID, you're somewhere. Hopefully, some of it is gives a new perspective. I do have some slides, and I'm going to share and talk through those. Sorry, give me a minute, guys. Can you all see my screen?
Not yet, Ram.
No. Let me talk through it any which way. So I think there are three topics that we need to kind of cover. One is on, how do we kind of sustain behavior change, and what is that, we need to be doing in terms of designing or intervention design. and few more topics. The first thing I wanted to start is by saying that, we have to remember that we don't have a playbook for this, right? It's something new for all of us. There's a fair bit of uncertainty. The information is kind of changing rapidly on a day-to-day basis. And contrary to some of the beliefs that we had in the beginning, things are not going to get settled in the next few months or so. We are going to be in this for a fairly long periods of time, something like a 2-year period. Even in a best case scenario, if you're going to have a vaccine in say 18 months, by the time we distribute and get it to everyone, it's going to be 2 years. The scale and speed of this is quite unprecedented. Also, we are having to deal with a lot of complex trade-offs. It's not about simple behaviors like, invest some money. Every behavior has some intended or unintended consequence. Oftentimes, a solution brings with it a new problem. We must also be quite conscious of the fact that we're going to be making a lot of mistakes in this. If we now look back at the last 2-3 months, we can actually see several mistakes done by fairly reputed organizations. I mean, again, it's nice to be wise in hindsight. At that point, they didn't seem like mistakes, but now they do seem like mistakes. And as professionals in the behavior change space, we have to be mindful of the fact that we are going to be making quite a few mistakes ourselves, and therefore it's a learning opportunity as well. That it's going to be a humbling experience for a lot of us. So therefore, it's an opportunity to kind of build a new playbook as opposed to using an existing playbook, which is usually the case that we do. I mean, there are a lot of simple behaviors for which we have playbooks. So this is a situation where we don't have one. So we have to see this as an opportunity to kind of build a playbook, learn, and be humble that we're going to be making a lot of mistakes. The first one, that we're going to be covering is how do we kind of sustain, behavior change. We're now dealing with multiple behaviors simultaneously, right? It's again not about one behavior at a time. It's not about hand hygiene. It's not about coughing or sneezing into your elbows. It's not just about sitting at home. So we're dealing with multiple behaviors simultaneously. That's a big qualitative difference from the usual. The other thing that typically happens is when we talk about behaviors, we focus too much on end users, right? We keep talking about, masses and people in general. But in this case, we need to focus a fair bit on providers, businesses, authorities in particular, apart from users, right? So you need a fair bit of cooperation and behavior change from providers themselves. Recently, there was a nice piece by Esther and Abhijit on the kind of things that we need to do. So one of the things that they recommend is to have some kind of an early warning system. So there are a lot of these what we call as rural medical practitioners or quacks in some states like say Uttar Pradesh. If they start seeing a spike in flu seasons or the amount of flu, we would want them to kind of report, rapidly so that you can kind of, contact trace or have a response. So it's not just from a user perspective. You have to think from, a lot of providers as well. Again, businesses. I mean, we now know that there are several vectors like airlines and hotels and a lot of other kind of settings where we need a significant kind of changes in the way that things are done. So that's another thing for us to kind of bear in mind. Now, I'm not going to talk about individual behaviors, but I was thinking, what would be a good framework to think about when we have a situation where where things are changing rapidly, where we're dealing with multiple behaviors, and we really cannot sustain all these behaviors for a long period of time. So one way of thinking about is a simple axis. And once I'm done, I can send you this document for you to kind of look at it. So you have an x-axis, which is about episodic behaviors on the left and consistent behaviors on the right. Episodic as in some behaviors that you need for a short period of time, like say self-isolation if you're symptomatic, or wearing face masks in public spaces during flu seasons, or caring for vulnerable populations during high-risk kind of contexts. On the other side, you have much more kind of constant behaviors, right? So you're thinking, how do we deal with stigma reduction, or hand hygiene, which is much more kind of a thing that you need on a consistent basis. And on the y-axis, you have top-down and bottom-up approaches. What is that you need authorities to drive? It could be a health authority, it could be a government, or something like a quarantine or a lockdown has to come from a fairly top-down one. But there are a lot of bottom-up behaviors which a state cannot implement, like wearing masks in a public kind of setting, or how do we kind of reduce stigma on a day-to-day basis. So those are the a simple axis for us to kind of think about, and then have differentiated strategies for a type of behaviors like physical distancing or charity and philanthropy in a pandemic kind of a setting, right? How do we kind of do that in an effective manner? So for example, there is a PM Cares Fund where everybody is kind of donating, but in such a widespread pandemic, you need a lot of local social organizations that need to kind of kick in. How do you kind of make sure that this funding is well distributed and not like highly concentrated? So there are different set of behaviors that we need to kind of think about, and one simple way of looking at it is a top down, bottom up, episodic and constant, rather than trying to change every behavior all the time. And some standard rules kind of apply when we think about sustained behavior change. There is a premium in authority, and therefore trust in authorities is super critical. We already see a lot of misinformation, mistrust in authorities, and that space can be taken over by a lot of people. So I think much more conservative response from authorities is what is kind of warranted. Much more consistent kind of messaging, much more empathetic kind of messaging, whenever we talk about what people should be doing. We should also understand some risk reward dynamics. Is that, so for example, if there are a lot of young people in the beaches or partying, it doesn't mean that they don't understand risk, but they are placing the reward on a higher scale. And the more we understand the reward side of things, we can use that balance quite well rather than just focusing on the risk aspect of it. The third principle I would say is that feedback on collective behaviors needs to be localized. It's a bit like climate change, right? So I've done my bit. So what has it done to the pandemic? The national numbers are coming down or going up. What does it mean? So the more we have much more localized data, what's happening in my county, my state, my town, the more closer to home that it can be. And that sort of feedback on the impact of collective behaviors can help people continue some of the behaviors that they're kind of doing. The other areas that we have to identify, which are the big vectors. It could be religious gatherings, it could be airlines, it could be whatnot. And we need strong commitment and consistency from the authorities that manage these vectors. As we kind of move forward, we can think of same behaviors and new benefits, right? So how do we kind of sustain something like a hand wash? Assume 6 months, 1 year down the line, the intensity of the pandemic has kind of gone down. We need to think about some of the new benefits, right? The protection from diarrhea or some other infections. That's one way to kind of sustain the behavior, give new reasons for people to kind of keep that going. The other thing, again, when we talk about behavior change, we tend to club social and behavioral change, whereas the social component moves much slowly, is much more complex. And so here we have a great opportunity where there is a rapid change, in social norms. It's not I was giving an example where my brother-in-law went to a grocery store without a mask, and he was literally kind of chased out. And this is a rapid change in social norms. We need to think about how we can leverage some of these norms. And lastly, on the principles, we need to be mindful of, the behavior change fatigue. Uh, in the sense that if we keep hammering too much of messaging on too many behaviors, you have a real danger that you might kind of, lead to some kind of or push fatigue in some cases. The next one, very quickly, I want to talk about information overload and misinformation. You'll see on the slides a book called The Age of Insight. It's a fantastic book by Eric Kandel. In that, he talks about this case where whenever there is a lot of anxiety, we tend to pay more attention. So painters introduced an element of anxiety in their painting and noticed that a lot of people in galleries would spend more time in front of those paintings that had an element of anxiety. So what's going to happen now is, because of all the anxiety, people are going to pay a lot of attention. None of us like uncertainty or ambiguity, and therefore we try every bit to kind of reduce it. Again, when you get those slides, I've linked a video of my colleague where he talks in depth about ambiguity of aversion, which in itself is an interesting topic. So how do we deal with this information overload when a large population is actively seeking information? For starters, I think it's a difficult one from a user perspective. It's probably the onus is much more on the authorities. But if you move to the next slide, the point I'm making here is that there's nothing like a good distraction, right? When people are all constantly thinking about COVID, the first thing that we can do is to provide good enough distractions. The analogy I would normally use is airlines. Airlines create a lot of distractions because air travel is fundamentally kind of painful. So serials like Ramayana, Mahabharata, or any such thing that happens is a good thing. In some ways, it provides a good distraction. And there is also a lot of information and action asymmetry. Just because there is a lot of information coming doesn't mean that we have to change behaviors. The things people need to do are not changing. They need to stay at home. They need to wash their hands. Those things are not changing. Whereas information and data is kind of coming at a rapid pace because it's an unknown risk, and people are constantly trying to recalibrate, the risk to self. So it's a difficult problem to deal with at a user level. Something for authorities and media to think more carefully as to how they want to kind of deal with it. A classic case is the hydroxychloroquine thing, where somebody says something about the effectiveness of this medication. It's a needless information because we still don't know full facts, and it has kind of led to a lot of hoarding and improper usage, right? So I think like I said, the onus is on media and authorities to reduce information or be more careful rather than kind of pushing a lot of information. So one example I would see is a daily update is say much better than a tracker that moves like stock market. In the state that I'm in, Illinois, there is one briefing that happens at 2:30 p.m. every day, and the numbers are announced then, as opposed to New York, where the numbers are changing every hour. That kind of leads to a lot more anxiety. So one simple idea could be, I'd pick one authority per state, again, largely because of language issues in India. At the same time, every day, I would provide a COVID update on, facts and myths, rather than doing this, constant trackers and, continuous kind of news. So therefore, we should try and create, and everybody should kind of point out to this one authority who can, deliver a quick kind of an update. And the last bit, probably take a minute and close it. So as we think about what behavioral science principles we need to do, use in messaging, or how best to kind of use behavioral science principles as far as, intervention design is concerned, I'm not going to be talking about individual principles, but focus on systems, right? And usually when we talk about behavior change, we have the luxury of a lot of research. We go to several users and then come back with some strategies. But this is a case where we don't have the luxury. Equally, there is a high premium on a wrong decision, a high cost on a wrong decision. So therefore, we need new models, right? So one example could be a messaging task force that kind of works in the background, which does rapid testing and of messaging. So I'm not talking about days, but I'm talking hours, right? So if I have to issue a briefing at the end of the day, how rapidly can I test these messages with a panel of users and then get to better framing rather than just thinking of 5-6 principles and designing messaging around that, or building simple toolkits, right? So how do we kind of communicate to millennials? We saw this classic case where there's a lot of admonishing that happened where people were told that you're being careless, you're being reckless. That's absolutely the wrong way to kind of talk to young people. But a lot of that happened. But these are simple toolkits that we can kind of build and use when we don't know much in advance as to what are the messages that we need to kind of put out. So I think there's a good opportunity to build a behavioral science and design playbook for a pandemic response. Like I said, this is something that we're going to be in for a year or two at the very least. As practitioners, I think there's a great opportunity, and Final Mile, that's one thing that we are trying to do, is to push through a lot of content, not in a rapid kind of way, but to think about them for a few days, think more systemic rather than principles or specific behavioral science principles. That's my bit. Thank you.
Thank you so much, Ram. So just to do a very quick recap, I think we discussed one of the interesting points here was a top-down approach is essential as much as a bottom-up approach. And secondly, the fact that we need a feedback on collective behaviors and they need to be localized. They need to be more closer to home. And lastly, the fact that we need toolkits. We need to come together and build better toolkits, and new models need to be designed where we can test and frame messages that can be shared with a wider audience. So I'm going to move on to the next speaker, but just before that, Junafri has shared a poll, and that you can participate in the poll as and when you like. Moving on to the next speaker, we've got Sana. Sana is a behavioral scientist based out of India and UK, passionate about sharing insights from psychological science and analytics to improve the quality of people's lives. She advises both public and private sector clients how they may best systematically use behavioral science as a transformatory tool, policy, provision of services, and product design. She consults for Dalberg Asia, supporting project teams and clients in integrating behavioral science into designing and evaluating products, initiatives, and policies worldwide. Over to you, Sana.
Thanks, Pankti. So thank you for having me. I will just start by saying that, I think that we are currently dealing with one of the largest behavioral exercises of our lifetime. As we all know, it is our everyday behaviors and our actions that are playing such a huge role in the virus's spread and transmission. Now, as behavioral scientists, we're on uncharted territory as well. As Ram Prasad said, we don't have a playbook for this. All we can do is kind of use principles and guidelines from what we know of how people behave, and we can apply them. Now, the WHO has listed 13 behaviors that are important to reducing the transmission of coronavirus. Some of these are more important than others. Some of these are more kind of country specific, but we know that hand washing, personal hygiene, and physical distancing are here to stay. Now, as behavioral scientists, we can call upon a body of applied scientific knowledge and evidence, and we can try and apply it where it works. There are lessons to be learned for governments, and we can do kind of quick behavioral experiments to see what works. But as we know in India, we face a very different scenario. right? We have millions of migrant and daily wage workers where social and physical distancing just doesn't work. We have community, religious, and social norms operating at huge complexity. And we have a number of constraints on capacity, on resources, on medical supplies, on hand washing stations. So in India, we can't just deploy the same evidence-based kind of one-size-fits-all approach because it's just not going to work. So as India faces this crisis, how do we leverage a discipline like behavioral science? And in the next 10 minutes, I'm just going to share some high-level points that we can consider. And once we move into the Q&A, then I'm happy to take some further questions. The first thing that I'd like to talk about is mental and cognitive bandwidth. And we're taking this principle from behavioral science. Now, at this time around the world, many of us are finding that we have a lot more free time. And in that time, we would hope that we could be more productive. But I'm sure many of you will resonate with this. It's increasingly harder to be productive. There is so much collective anxiety and stress. We're being bombarded with information and social media consumption and the news. And our mental and our cognitive bandwidth is operating at a much lower frequency, and it's actually much more depleted than it would be normally. Now, what we know from behavioral research is that when we talk about vulnerable populations, when we talk about people who live below the poverty line, what we know is that their mental and cognitive bandwidth is even lower. We know this from studies, right? There have been studies, famous studies of sugarcane farmers who perform better on cognitive tasks after harvest than before harvest. Now, what this means is that these vulnerable populations do not have the bandwidth for complex decision-making at this time. There is not the bandwidth to adopt entirely new behaviors, which means that whatever messaging and communication that we're designing needs to adopt the path of the least resistance. So if we keep this larger principle in mind, there are a number of implications of how we need to communicate and message important information on coronavirus. For example, there is a need for huge simplification of information. And where we can really do that is using visual cues and visual information. Some of you may have seen kind of photos of policemen in Karnataka who are wearing kind of helmets that are kind of shaped like the virus. If you haven't seen it, I'll post the photo soon. It's a fascinating way of breaking down information into something digestible and entirely visual. The second principle that we can apply is that information needs to be immediately actionable, and it needs to be broken down into sub-actions. So when we have the message, avoid large crowds, that may work in the UK, but that's not necessarily going to work in India. We need to break that down into specific actions. Avoid large crowds at the temple, right? At the train station, at the bus station. We need to be specific and actionable. Another principle to follow is how we can use people's existing behaviors and existing platforms to really reduce the effort that is needed to adopt a new behavior. Now, the Indian government has recently released a kind of MyGov chatbot, which is integrated with WhatsApp and Facebook, and it's actually releasing information on coronavirus, on signs, on symptoms. And we need more of that. We need to leverage digital technologies that people are already using and use that to help people change their behaviors. There's also social norms. Ram Prasad touched upon this as well. You know, what kind of messaging? We need to very quickly test what kind of messaging is going to work. Right? In everyday life, but particularly in social crises, we tend to look to what other people are doing for information, for guidance. So when it comes to a crisis like this, what kind of messaging is going to have the greatest impact? Right? Is it messaging that comes from an expert authority? Is it messaging about what our neighbors are doing, what our community doing? Is it messaging that uses statistics? Right? We need to very quickly ascertain what's working. And finally, storytelling. I think as behavioral scientists, we have a tendency to over-index on the science, and we tend to forget that the way that we tell a story is equally important. Storytelling is a hugely powerful way of influencing behavior. And it does this through eliciting emotional responses and making things feel relevant. And we've seen this in the public health sector in terms of kind of increasing HIV vaccination, cervical cancer screenings. So how can we leverage the power of storytelling and the narrative and bring that in with a behavioral science approach. Now, related to messaging and communication, another point that I want to focus on is community involvement and participation. If we go back to the 2014 Ebola crisis, during the first few months of Ebola, there was a huge amount of misinformation and confusion, right? So people thought that Ebola meant instant death. They thought that Ebola was a curse, and that foreign doctors were in these countries because they wanted to harvest people's organs for scientific experiments. Now, as a result of all this misinformation, public health officials invested most of their resources in kind of mass pushing out of messages, telling people what to do. But this didn't work. This actually ended up backfiring. It led to more confusion and more resistance. The second wave of response then focused on kind of the signs and symptoms of Ebola. But again, what happened here, and this was happening through mass media campaigns and print and posters, again, kind of demand ended up exceeding the response capacity, and there was still confusion and misinformation. Now, in the third response attempt, public health officials focused on community engagement and participation. And so what they did was really put people at the heart of the public health response. Now, what this meant was bringing in community health leaders, health workers, religious leaders, people part of the local community to really kind of get their trust, get their buy-in, and then use them to spread the vital kind of health information. Now, as a result of this, people felt a part of a community response. They were more likely to change their behavior. They were more likely to eat properly cooked meat. They were more likely to stop traveling. But this whole exercise took time. And it came a little too late in the Ebola response. Now, where we are in India right now is that we're currently at that second response stage, right? We've got mass communication, we've got digital platforms, text messages, but the misinformation is still rampant. For example, I was reading an article on kind of misinformation in rural Uttar Pradesh, where Modi's, where the Janta curfew was actually for many people seen as a religious thing. People actually assumed that the curfew was being used so that Modi could spray medicinal solution to coronavirus. There are stories of households where women are, in villages, are beating thalis every evening so that they can ward off coronavirus and lighting diyas. So the misinformation here is rampant. And if we're really going to avoid these continued lockdowns, and if we're going to kind of this, as Ramprasad said, this is going to continue for some time, we need to adopt a community participation and involvement approach, and we need to do that soon. We need to start mobilizing for it. We need to plan for it. Now, this is slowly happening. There are examples of ASHA workers in Karnataka who have been deployed to go door to door, and they're collecting, information on people's health. But we need to have a more structured plan for how we're going to get communities involved in this. So those are just a couple of kind of high-level ideas that I wanted to highlight. But as we talk about behavioral interventions, there are a few challenges that I also want to kind of draw your attention to. I think the first is when we're designing any behavioral intervention, and particularly in a pandemic like this, we need to mobilize as many different strategies as we can on parallel timelines. We don't have the time to over-index on one approach and hope that that has a kind of desired behavioral impact. We need an integrated approach that uses multiple channels, whether it be mass media, community involvement. We need to integrate that and have a kind of unified approach. The second is, and this is a huge challenge that we're facing, the touchstone of behavioral science is evidence. But in a country where we have complexity, where we have all these millions of vulnerable people, we're kind of racing against the clock here. We don't have time to verify all empirical propositions. We don't have time to conduct RCTs or have an entirely systematic approach. We have to perhaps take things more on trust, on intuition. We need to experiment a little bit more. We need to innovate. So when we talk about social distancing in places where it's very difficult to actually socially distance, we need to innovate and think a little bit out of the box. Can we set aside time slots for the elderly to go to the temple or a mosque or train stations? we need to be a little less wedded to an entirely evidence-based approach. Another challenge is that we do need to be aware of the intended and unintended consequences of any behavioral intervention. You know, we're living in a state of constant anxiety, right? And in India, we have the stigma of already marginalized groups that we need to take into account. We live in a tense political climate. And I think whenever we're designing these behavioral interventions, we need to be very cognizant of the fact that these are factors that we need to continually address and account for. And finally, those at the helm shouldn't just be policymakers and politicians who are working in silos. Behavioral interventions need to meet policy, and experts need to be unified across disciplines. What this means is we need to coordinate multiple teams. We need to have teams of microbiologists, of behavioral scientists, economists, policymakers. You know, if we're introducing more hand washing stations, we need to introduce behavioral design at the level of inception and concept development. Or if we're rolling out a digital platform like the chatbot, we need to be building in behavioral science as we develop it. And that's why I think conversations like today are so important. And I'm really hoping that we can use this webinar as a springboard to kind of continue this discussion and perhaps set up a working group in India that can very quickly lean in to the problems that we're currently facing. I'll just pause there. Thank you.
Thank you so much, Sana. I think that was really, really insightful. Just to summarize and recap very quickly, Sana spoke about mental and cognitive bandwidth of vulnerable populations. They don't have the bandwidth for complex processing of information. So we need to ensure the messaging is simple and basic, and visual cues can be very helpful. Information, it needs to be actionable. It needs to be broken down into specifics. And message testing here is very necessary, as Ram Prasad also mentioned. And we need to emphasize on storytelling. And lastly, community participation is really important, because that's where because you need to get the buy-in and trust from people, which helps people make which helps people make better decisions and follow better behaviors. It makes it easier for people to follow behaviors if they have buy-in from the community. Great. Moving on, the next speaker for this evening is Varun. So Varun Gauri is a senior economist at the World Bank, where he co-heads the Mind, Behavior and Development Unit. He co-directed the World Development Report 2015, Mind, Society and Behavior. He serves on the editorial boards of the journals Behavioral Public Policy and Health and Human Rights, and has been a member of the World Economic Forum Council on Behavior and on the board of the Behavioral Economics Action Research Center at the University of Toronto. Over to Varun. I think, Varun, you're muted. We just need to unmute you. Yeah.
There we go. Can you hear me now?
Yes, perfect.
Good. Okay. Good evening, everyone. I hope everyone is doing well and is taking care of their family and everyone that needs to be taken care of under these crazy circumstances in which we all find ourselves. I want to start with the observation that Ram made, that we don't have a playbook for this. I think that's really absolutely true. It's really, though, unfortunate that we don't have a playbook. From a behavioral point of view, what a playbook is a default option. Had we had a playbook, both for ourselves and the behavioral community, as well as for policymakers, we would have been able to pivot precisely to a set of actions that require less bandwidth on the part of policymakers, behavioral designers, households, and everyone else. People have been anticipating a pandemic for many years. You can just go back and look at all the reports. There's a board game called Pandemic. There are several movies. It's really quite, I don't know what the right word is. It's extremely disappointing that all of us, including myself, did not plan and develop a playbook for a circumstance like this. I think our immediate task really is to develop a playbook like that as soon as possible, and to anticipate other challenges. Once we ourselves have the bandwidth to anticipate other challenges going forward so that we have a default option for all of us when crises like this emerge. I'll say a couple more words about this in a minute, but that's really my overarching message, I think. So some particular points that I want to emphasize, and because we don't have a playbook, these are sort of observations rather than a framework or an overall approach at this point. But I want to start by discussing masks. There's been a discussion about whether people ought to be wearing masks, whether they create a disinhibition for social distancing, whether they ought to be safeguarded for healthcare workers who need them particularly, and of course they do, as well as people taking care of people with COVID-19. If you look at the current WHO guidelines, I'm not sure if you'll be able to see it, but I'll try and put them up. I might not be able to share the screen. I think I'll have to do this later. But the current WHO guidelines are consistent with what I just mentioned. Wear a mask if you're healthy, if you're coughing or sneezing. If you're healthy, you only need to wear one if you're taking care of someone with COVID, or when if you're coughing or sneezing. They're only, if you wear a mask, you have to know how to dispose of it. There's a sense that they're not essential. This has been mirrored by authorities around the world, including the Centers for Disease Control in the United States. There is evidence, however, that masks can be effective. A 2008 study found that there was a 68% reduction in transmission of SARS from wearing a mask, for people who are wearing masks. By comparison, hand washing 10 times a day reduced transmission of 55%. I think that there's been a message going out that says they're not effective, when in fact the message which should have been, they're potentially effective, but healthcare workers get priority. And I think the lack of candor has contributed to confusion on the part of the authorities who are discussing this issue. I think we need to be candid and present people the full truth. I also think that there is a behavioral side to mask use. When people are wearing masks, it sends a signal that we are all observing that there's a crisis going on, that things are changing. We need to keep our distance. One can imagine masks with messages on them. When people don't have masks, one can use homemade masks, scarves, dupatas, whatever is available. I think that's an area that is it's an actionable area that I think that we can begin to make some headway on right away. Second point I want to make is about experts. And for this, I really wish I could share this slide. Let me try one more time. Can you all see that slide or no?
Yes,
Yep.
we can.
Okay, so this is a picture in which experts in the United States were asked to estimate the number of COVID-19 cases 2 weeks later. You can see that the average estimate was about 20,000. The correct answer was 122,000. These were experts. Several were epidemiologists. This is not my data, of course. It's attributed to the website 538, University of Massachusetts Amherst. Even with error bars, most people weren't able to get to the correct answer. So I think that at this time, when people were asked, there were 3,500 cases in the US. There was also evidence that the virus had been circulating in Seattle for 6 weeks. That was printed on March 3rd. So even though there was some evidence to suggest that things were much worse than they appeared to be, and that many people knew that only, say, 10% or so of cases were actually reported in the data, people were still underestimating what was going on. I think this really speaks to the fact that, we have a hard time getting our head around exponential growth. and to the fact that people weren't ready for a situation like this. And these are experts. So I think what this means, and I'll stop sharing now, is that experts and policymakers themselves are suffering from bandwidth overload. We need to keep that in mind when we design policies for them. And I think this also speaks to the fact that we need to develop a playbook, you know, as using Ram's term, or really a set of default options for policymakers themselves to use. Some of these are economic in nature. We can contribute to the construction of triggers about the size and duration of direct benefit transfers, qualifications that households need to exhibit to qualify for these, certain rules like suspension of the display of qualification rules, whether they be, you know, something about, you know, Aadhaar or about the BPL cards or whatever it may be in the country in question. I think generally speaking, we need to also think through how people are thinking about poverty and the situations which people who are poor find themselves, and develop defaults for them as well. Let me also now try to share, if I can, another picture, which is actually fairly haunting. Can you see this picture? This is in Las Vegas, and these are homeless individuals who have been.
The picture isn't visible yet.
Ram, we can't see, sorry, Varun, we can't see the picture.
Oh,
there we go. Yes, we can. Yeah.
Okay. So these are homeless individuals in Las Vegas, and they've been laid down in the street, and you can see they've drawn out 6-foot spacing for the location of where they're going to be. Of course, you know, one doesn't begrudge the authorities for trying to keep them safe, but the fact that the preparations have come to this, and that one hasn't thought of the larger set of structural and social issues for a needy population, and anticipated it, and thought about the ways in which those various constraints affect their lives and ahead of time, really brings forward the importance of having a playbook so that we know exactly, you know, how to deal with complicated situations. I'll also make an observation, and this is related to Sana's point about evidence-based and being less evidence-based in a situation like this. I completely agree with one caveat. I mean, I would say that we need to change what we think of as evidence. In the behavioral policy world, our standard approach when when a problem arises is to think through our list of, you know, many biases and heuristics that people use when thinking about a problem and deciding, or when choosing to make a certain kind of behavior. And we all know what they are, right? We know something about loss aversion, about risk preference, intention-action divides. All of these things will affect anxiety, ambiguity aversion. All of these things will affect decisions on the, you know, in response to the pandemic situation. The challenge, of course, is that this is a crisis, and there are multiple. There always are, but in this case, there are especially the cases there are multiple problems and biases and heuristics at play. Ambiguity aversion, loss aversion, in-group, out-group behavior, mental models of disease, trust in science, trust in government, and how any of these are going to play out in any given time is not obvious. We don't really have time to think through and to test. We wouldn't even know how to, you know, even in the best of circumstances, would have trouble designing a test that could tease out all of those various different biases and their effect on behavior. So I think we need to expand our understanding of what evidence means. And in particular, I think we should turn to history. History of similar situations or analogous situations in the past may provide some clue of how systemically, certain interventions, certain policies interacted with certain behaviors. Because we can't control for all these biases at once and think about how the system responds. You know, we don't really even have great behaviorally informed game theory, let alone, you know, in a cultural context. Looking back, say, at the 1918 pandemic globally really is informative. I mean, I think some of the most informative guidelines for what ought to be done for epidemiologists come from comparing, say, Philadelphia to St. Louis in the US, and the impact of closing down schools early in St. Louis relative to Philadelphia and what that meant for transmission. Also work that looks at what that meant for the economy in those locations. That's just one example, but looking back at previous pandemics with a behavioral eye, I think that's what we can add, and trying to understand other crises, you know, politically, you know, an emergency, something like that. How do people respond with respect to trust and things like that, and drawing on that for thinking through what ought to happen now. And then finally, the last point I want to make is about transparency. I think we need to go out of our way to be transparent, because there's a famous line, I believe it's attributed to Paul Volcker, that said that in a crisis, the only asset you have is your credibility. It's crucial that governments, policymakers, scientists retain their credibility. I think it's crucial that we as the behavioral community retains ours. We are not able to quickly do RCTs, as we've discussed, but I think it's useful to, as I mentioned, you know, in that graph I put up about asking policymakers what was going on to predict what's happening 2 weeks later. Maybe we should think about pre-registering our guesses, pre-registering our estimates in order to refine our intuition, in order to be completely transparent about the recommendations that we're making. And then finally, sort of related, I think in order to build transparency, we need to pick our battles. in order to maintain our trust, we need to pick our battles. We can't fight everything at the same time, precisely because of all the challenges of information overload that Ram and Sana both referred to. I think we need to sort of be sure to prioritize those interventions, ideas, policy innovations that could really make a difference, and not necessarily overload people with, for instance, an idea that, you know, well, it's this bias that's getting in the way. I mean, I think people need more than that at this point in time. So just to summarize very, very quickly, I think the main challenge is the fact that we find ourselves in a crisis without a playbook, which is really a crisis without a set of default options. It's unfortunate, but here we are. We need to begin to build that playbook in real time as we go forward. Thanks so much.
Thank you so much, Varun. That was really interesting. Just to have a quick recap, one of the things you talked about is the fact that messaging around the whole pandemic and the situation has been very confusing due to lack of candor and communications. And case in point is the use of masks, whether people should use it or not use it. And the fact that even policymakers and experts are overloaded, and they have cognitive, their cognitive abilities are overloaded due to the overestimation. And lastly, and most interestingly, the point that you made just now about transparency, I think that's a really important point. Everybody in this field needs to be more transparent about what they're doing and how it's going to work and if it's going to be impactful. And as you rightly said, credibility is extremely important in a crisis. Thank you so much. We're going to now turn to our last speaker, Avni. So Professor Avni Shah is an assistant professor of marketing in the Department of Management at the University of Toronto, Scarborough, with a cross appointment to the marketing area at the Rotman School of Management. Using field and laboratory data, Avni investigates how payment influences consumer decision-making and consumer well-being, particularly in financial and health contexts. Avni's work has been published in the Journal of Consumer Research, Journal of Marketing Research, and Psychological Science. Over to you, Avni.
Hello, can everyone hear me? Yes?
Yes, perfect.
Okay, wonderful. So one of the good parts about being last here is that I get to basically agree with all the intelligent things that my fellow panelists already said. And so I do actually want to reiterate some of them and kind of give some additional examples, as well as touch on a couple of other things. So one of the most important things, and in fact, I think it was even brought up in some of the questions, is that we have to consider the context, right? India is a different context than a lot of the other behavioral interventions that have been run before, and even a lot of the other countries that are going through this particular crisis, this COVID crisis. And so what that means is that there are just different habits that people have formed, different things that motivate them. And one thing I want to turn to in particular is let's understand what is going on and kind of think about this larger scope of the difference between more individualistic societies versus collectivist or kind of community-based societies. And the one thing that is quite different here is that India, like many different other parts of the world, India is much more collective. And what that means is that we prioritize our own interdependent goals relative to the independent goals that we have, versus, let's say, the US or even Canada, where their prioritization is the independent goals. So how do I save myself? Now, where does this play in with the coronavirus and taking care of ourselves is that in a lot of cases, individuals, you're really asking individuals to basically go away from the habits that they've formed for many years, generations, things like going to see our fellow kind of neighbors, see our family members, even make sure that they're taken care of. And that really goes against the principles of this idea of social distance and even what the shutdown is. And so that you're already then fighting all these norms and these habits. And so what I would turn to there is that it is up to behavioral science. It is also up to kind of effective message communication to really change the narrative. And I'll steal a little bit of some of the things that Sana was saying earlier. In this case, then it has to be more about this collective effort, right? And saying, let's understand what our actions are doing that could basically impact the collective welfare. So an example being, hey, just ignoring, kind of maybe ignoring some of the social distance measures, and then instead going home, right, going to different villages that maybe where you're from, really, and then potentially kind of carrying the disease can be very problematic. So instead, let's champion the notion of social distance as a collective welfare mechanism. So saying that by staying home, right, by staying in place, that actually helps people, and that is something that would benefit your family. So you're staying home because you care for your family, because you care for the well-being of your friends. And I think that messaging really needs to be important and really needs to be in place, because then it's not a situation where individuals are saying, well, I want to take care of my elderly parent or my grandparent, or take care of even my elderly neighbor. These are all very kind of traditionally even Indian behaviors, but then they could come at an expense to overall health. Now this gets to, I think, another item that was mentioned about the collective responsibility and kind of community. So one thing we're seeing is that for a lot of migrant workers, a lot of individuals who are part of these vulnerable groups, a lot of them are being, they're typically living day to day. And so for many of them, they're sort of stuck in this situation where they have no money coming in. And so obviously the most logical kind of step is to then go and walk back to their villages or where they've come from, which is, again, as I mentioned, problematic. And so in these situations, I think the government or sort of even private organizations can step up a little bit and say, well, let's take a more community action, a community appeal, and let's take care of folks in a way, because it's then obviously detrimental for the spread of disease. So I turned to a model that I had done some research on earlier, and it was in Ethiopia. Ethiopia suffers from a lot of chronic famine, right, and food insecurity. And so they established a thing called the Productive Safety Net Program. And the idea there is that it was kind of community, the government was working in conjunction with communities, because similarly to India, there's so many different context-specific and kind of community-based just identities there. So there it was important, and just differences within these kind of, we have like GAMs, right, in Gujarat and similarly to all over in India. So this could be kind of a similar analogy there. And what they would do is that the government would allocate money that they would then give to these small villages and communities in order to distribute for to help people who are more chronically food insecure, right? So then the community members would then dole out this money to the people who are most vulnerable. Now, in exchange for this, those few people that were most vulnerable would then do a kind of a pay for work type of service, where they would do things that would help the community. So they would build, they would do some, invest in more crop resilience. They'd build wells, they'd build schools, they'd even help with the roads. And basically what it ended up creating was a far more communal type of attitude where everybody was included. There was then much more benefits where you could see, hey, look, this is the work that our community created. And then you were taking care of individuals who were, in fact, suffering, right? And were suffering where they were kind of living on day-to-day wages, that they were not available because of famine in different ways. Now, I would say we can blend that over and do that same sort of model in a situation like this case for these migrant workers or some of these really, really poor individuals, where as a community, we can take care of these individuals and say, well, they're suffering, they need the day-to-day wages, giving them a little bit of money to take care of some of the jobs, right? Some of the jobs of disinfecting, for even putting up signboards, for simplification messages, for example, for doing even delivery type service, right? And then of course, equipping them with the protective gear so that they're not suffering from any ill effects of either coming into contact with individuals or virus transmission in any different way. So protecting these folks as well. And so then in that way, then we have a partnership. And imagine if we had all these different types of jobs. So maybe art, right, where we can have even murals or displays of art, of these simplification tools and messages to make it easier for people understand, okay, it's good to stay at home, communicate over video app, right? We could draw some of those things out with artists in the local area to help them benefit, right? And I think that ends up then just benefiting the entire community and taking people in kind of within that community so that we're not having folks travel. So that's, I think, one thing that we could do is really leverage this collective mindset, this interdependence, to not only help people stay in place, but then also take care of the most vulnerable. I think another thing that was mentioned is this idea of simplification and the importance of making it easy. Now, I think Dr. Sana was mentioning that the World Health Organization had 13 different behaviors to help. That's a lot, actually. It's quite a bit. And so as a result, it might be helpful to create what are the maybe 3 most important ones, and then really promote those messages, right? So I would say hand washing, social distance, and then maybe covering your face, right? And even creating differences where you show different members of the community doing those things. And that's the beneficial way. Or even I would say in cases where it would be easy then to then give people rules of thumb. So say, okay, everybody should be washing their hands 20 times a day. If you're doing it less than that, then maybe you're doing it too few times. And make it easy for individuals to do those actions and kind of use these heuristics, these rules of thumbs in ways that could benefit. But then I think we also need simplification in these tools in ways to make it transparent and easy when we are kind of having to engage in behavior where we have to go maybe get food and produce and supplies, or go out even for medicine and things. And so I'm going to share this one image that I saw where it's leveraging kind of tools of behavioral economics of one of my colleagues also worked in this project of like cue guides, right? And so here, let me share this one particular image, right? So let's see here, right? And so in this particular image, what I really, really liked here is that everyone was maintaining a particular distance, right? And this was actually in India. And they used this cue guide outside a general store during this lockdown. So even folks that had to go in a particular way and had to go outside were able to very easily understand that because this is not the norm, right? And so you're making it easy to see that, okay, these are the habits that are now the new normal, if you will, right? And so I think that's another effective strategy here that would make it easier. I also think this is particularly effective because we were, many individuals in the panel were mentioning the role of technology. And I think technology is a great resource, but not everyone, obviously, we know, has smartphones. I think the latest stat that I read was there's about 493 million individuals in India have a smartphone or some regular access to internet. So it's easy for some people in this case to then get the information, right? The kind of real-time information, but it's harder for others. So I think things like these cue guides or messages where you maybe have murals in different communities or even signposts that help with these easy to remember tools of maybe like hand washing 20 times a day, or even rhymes, cover your face and stay in place, right? Things that make it easy for people to remember the top messages that are the most impactful for this particular behavior. And then I think the final thing is, one of the things I'm seeing a lot of right now is that the news is fantastic as a way to disseminate information, but it's also depressing, right? And we have to understand that a lot of these behaviors that go against our very being of being human, the social forces that we're social creatures. We want to be brought together, and particularly, as I was mentioning, kind of the more communal mindset that particularly we as Indian people have, and collective welfare overall, and wanting to interact with people. And that's a daily behavior. That's very much ingrained in our motivation of how we live and sustain ourselves. And so these behaviors of social distance become very, very difficult. So getting feedback on the positive messages or the positive changes, I think are so helpful. And a lot of these things of social distance, the positives won't be felt for many weeks. So instead, why don't we translate to the fact that some of these positive behaviors, such as covering the face or hand washing, why don't we look to then changing the message there where it is a social norm? So we could say, hey, great job. Let's see, everybody that walks outside should have some sort of face covering, whether it be a scarf or dupatta or even then a mask. Right? I mean, that is something we should champion and say, okay, we want to be a leader here. Everybody should have this. So gold stars in those cases, that's a heroic effort. It's like, oh, look, 95% of the people are wearing something to cover their face, right? Or we're seeing huge dramatic decrease in the number of people outside. That's a huge positive, right? I think hearing those things is twofold, right? It makes individuals feel like something is happening, right? That there are positive behaviors in place and positive change. And then it's also creating a new normal, a new social norm that is then easier to follow. Well, everybody else is doing it, then I don't want to be somebody who's deviating from that particular behavior. And I think that also then has that positive well-being effect. Okay, we're helping each other, we're doing these things. So even promoting, that's where I think the storytelling aspect becomes helpful. So having those stories of, okay, look at all these people that are staying in place, and look at all these cases where our community is banding together, and promoting those stories and having coverage on those stories is also something. I think then we get the positive news, it's socially reinforcing, changing the norms, changing the habits, and then really using our motivation of the fact that we are kind of a collective social being, but we're doing things for one another, I think makes it easier as well. Thank you.
Thank you so much, Avni. That was really interesting, especially the whole individualistic and collectivist approach to how Indians approach the situation versus the Western context. I think that's a very interesting point. And just to recap, you mentioned things about technology and the fact that not everyone has access to technology, and making rhymes and visuals. And I like the mnemonic, really, but things that make essentially things that make messages simple, and they become the new norm, which people forward around on WhatsApp instead of fake news and misinformation. No, that was really interesting. Thank you very much. We're now going to share results from the poll. I think Junopia has got them ready. Yeah, there we go. So can everyone see them? So interestingly, we asked everyone about how strictly they've been following the guidelines for social distancing and hand washing. 50% of people who responded said they've been following it very strictly. 41% were strictly, and then 7% were moderately. So a majority of the people are following the rules very stringently. And then, how strongly do you agree or disagree with the following statement? I am afraid that either myself or someone from my family may actually catch the coronavirus. And 56% of the people agreed with the statement that they're actually worried someone close to them may catch the virus. So there is a lot of fear, there's a lot of concern about catching the virus and being in that situation.
Looks like a huge say-do gap.
Sorry.
Just saying, it looks like a huge say-do gap in the first one. And
definitely, yeah. So despite the fact that people are following all the guidelines strictly, they're still worried about the fact that they will catch the virus no matter what they do. So we're gonna move on to some questions. I think the speakers were advised to pick some questions from the Q&A box. Do we have any questions you'd like to answer, or should I just go ahead and pick a question and put it up on the table? I think everyone's muted. I think can all the speakers unmute themselves and show their videos so we can have a conversation? So one of the questions we had was, what can we do to help the privileged who can afford to be in a lockdown in India to empathize with the less privileged, those who cannot afford to socially distance themselves or have no extra cash lying around, or the way we're seeing the migrant crisis coming up in India? How do we kind of ensure that we empathize with them and try to support them? This is for all speakers, whoever would like to take it up.
So maybe I'll just say that it's definitely a concern. I mean, there's good evidence that when people are under stress, empathy declines, support for the in-group increases, and there's a tendency to sort of hunker down and not pay attention to those outside one's immediate circle. So, I mean, I think the standard things, of course, are something about a story and, what people call the single identifiable victim effect, actually show a single person who's suffering as opposed to laying out statistics. That can make people pay more attention to people who are needy. I think in particular in these circumstances, though, reminders of clearly actionable steps are important. Things like where to donate money, where to make contributions, ideas like checking on your neighbors, someone who might be a widow or might be living by herself nearby, find a way to check in with them. Maybe some sort of technological facilitation, like through WhatsApp, a list of people who could be contacted, some activities people could engage in, like, making masks for people who don't have them, things like that. So I think we can expect less empathy in the time being. We can use stories and pictures and single individuals to counteract it. But I think above all, if we can get clearly actionable steps, we need someone to curate that. That would be a great role for, say, this network. which consists of privileged individuals, to begin to put together.
Indeed, definitely. Moving on to the next question. Someone's asked, how can we make social distancing, hygiene, and self-help care a good behavior practice as a community, not just until the time we have the pandemic scare? How can we ensure that that's something that's sustainable, because it is good practice? It is something that we should be doing on a daily basis anyway.
If I understood the question correctly, I'm not so sure if social distancing is a good practice on a consistent basis. It certainly is not doable, in any sustained kind of manner. There are a lot of settings where it's literally kind of impossible as we go back to the old normal, like travel or being in meetings. But I think there are certain things that one can do. The point Varun was making on masks, I think, is a really important one. The advisory should have been much more conservative as opposed to much more definitive, saying don't wear them. Wearing masks or hand hygiene, I think those are some of the things that are achievable in a consistent long-term basis, as opposed to social distancing. Yes, there could be, like I said, if you think about it in an episodic way, yes, you can achieve that during the flu season, so to speak. But I think that's one way, like I was talking earlier, we need to break down which are the ones that we can sustain for a long period of time. My own personal view is that social distancing we cannot sustain for an extended period of time, not for years. You can achieve for several weeks, maybe months, and after that it's going to be literally impossible to do that. And one way of kind of sustaining that is thinking of some gateway behaviors. Again, echoing what Varun said, is that wearing a mask signals a very strong message that it could be a gateway behavior to many other things that we do in terms of hand hygiene and so on and so forth. So I think we need to one, have a good understanding as to what can reasonably be sustained and what cannot be. And then find new ways of communicating the same thing, in the sense that hand hygiene is useful for several other things, not just for COVID.
Right, yeah.
I could jump in and say something here. I think there's an opportunity here for someone like the PM or someone who's very interested in nationalism to take advantage of the moment and say that, the namaste is superior to a handshake. And it could be the end of the handshake globally. It wouldn't be such a loss, but I think there's an opportunity to be had for someone who's very nationally minded to take advantage of this and champion the behavior.
Incidentally, that's also an example or an inspiration cited in the UN call for creatives. The idea of promoting namaste as an alternative to handshake.
Definitely. Moving on to another question, we have one more question. So has the herd immunity claim made by the UK government about 3 weeks ago hurt the credibility of behavioral science, and just there in general, them quoting that they're taking advice of behavioral scientists and then kind of changing track of what they were, what the herd immunity, and then going back to the social distancing measures and the lockdown and following other countries' leads? Has that kind of, as a field, has that had an impact on the credibility?
I can jump in here. Oh, sorry.
Go ahead.
I've been in London for this lockdown, and so I've been quite close to the UK strategy for this, and I think it's a great question. I can see why the change and the pivot would lead people to question kind of the validity and the credibility. But I think this comes down to the overarching theme that I think has come out of this discussion and this webinar, which is that there hasn't been kind of there hasn't been like a structured set of guidelines that we've been able to follow. And so when something of this scale happens and this kind of unprecedented nature, it's people kind of follow what they know, what they think they know, and that maybe doesn't work. And in this case, in the UK, it wasn't the right strategy immediately. But I think it just kind of is evidence of the fact that, you know, we are, you know, we're exploring, we're experimenting, and so while I hope it hasn't kind of hurt the credibility, it's something that may keep happening as well. We're just learning kind of on the go a little bit as well.
Mm-hmm.
Can I just want to say one thing too, is that I think it's important. I mean, so the first few speakers, I mean, several of us were saying that there was not a developed framework, right? And that's okay right now, that's true, that we're acting as we go. But I think another important element of this whole process is that this is not going to be, unfortunately, right, with climate change and a lot of other things, this is not going to be the first type of humanitarian crisis that we are going to unfortunately face. And so I do think it's important to then make sure we are also, as policymakers, as informed citizens, I mean, jotting some of these things down, right? And being more prepared as we go forward to make sure that there isn't this spread of misinformation, or there isn't kind of mixed messaging, and being careful and more nuanced about the way that we frame masks, right? I mean, I think one of the, going back to the masks, one of the concerns was saying, okay, if we tell everybody that they need masks, then there would be a shortage for the people on the front lines, right? And I'm going to say front line, meaning even people who are working in the kind of grocery stores too. I think they're frontline workers, absolutely, right? Or all the folks helping out there too, not only the healthcare professionals. And so I think we want to also make sure we jot some of these things down now and develop these insights, just so that moving forward, we also have a playbook that is developed. And I think that's imperative, because this won't unfortunately be the first thing we face. And we shouldn't have ever an excuse again to say we weren't prepared and we have no idea what to do.
I think, yeah, the biggest failure would be if we didn't learn anything from this one moving
Exactly.
on. Yeah,
exactly.
Definitely. Moving on to the next question. So the average age of the people who've succumbed to the disease is open information across all countries. Do you think that has led to a lower risk perception among youngsters, and that results in non-adherence, especially? And I can imagine that so much in London and UK, people were still going out to the pubs over the weekend. But even in India, for that matter, if you look at, I think I just saw a video today, like in Dharavi, there were young men pelting stones at policemen. So do we think there is some non-adherence due to the fact that it's not going to affect me or a young person? And how do we kind of help combat that?
That certainly happens. I mean, people are trying to constantly kind of recalibrate or calibrate what is the risk to themselves. And therefore, you could have a set of people who think that they're not at risk. I think, as one of the panelists was saying, I think individualistic societies and collective societies might have not fundamentally different approaches to this, but slightly varying approaches. When you have messaging that you need this to protect, the more vulnerable people, or your parents or your grandparents. I think some of that messaging is important, but I think the way it was delivered in an admonishing kind of way didn't work. Two, this data is also changing, whereas in the US, I think about 40% of the people who are hospitalized are, between 19 and 44. So I think there is new data coming in that it's not just about thinking in these binaries of, life and death, but also the risk of hospitalization, the risk of serious illness. I think those are some of the other things to kind of communicate to this population. So overall, I think this has taught us that you need a much more segmented, empathetic messaging as opposed to one size that goes to everyone. And therefore, much more importantly, we need to think who is the person delivering message to each of these segments. Is this the president, or is this some kind of a youth icon, so to speak, who is in a much better position to persuade?
Right.
Yeah, I wanted to add, I think this is a really important point that Ram, you bring up, is who is the messaging coming from? We know from psychological principles here that basically you want a person that you would like to be like, right? And an in-group, right? Varun, you were mentioning this as well, the importance of empathy from the in-group. But that means this has to be integrative and holistic in terms of who's giving the message. So why not have, you know, we could have different movie stars, right? Also give this messaging at different age. The people who are the most kind of considered the most healthy, some of our cricket stars, right? Giving some of this message too, that everybody is not only vulnerable to this particular disease, but they care about making sure that they've protected themselves, and having those maybe billboards everywhere or advertisements everywhere. And I think that's important, is that we're all, and we're all standing, you know, and being socially, observing social distance. We're all making sure we're washing our hands. Imagine a whole campaign like that for kids, right? Even kid stars and things like that, just making sure that we have people from religious leaders, I mean, and you name it, because this is something that we have to, I think this is it, right? This is a whole, it's a community-based thing. It affects all of us. It's not affecting one group more than the other, although the consequences could be exacerbated by one group than the other. And the outcomes could be much more detrimental to some groups versus the other. And that's why we have to then take an approach, a preventative approach that is more holistic, and make sure our messaging is coming from all sorts of people, all sorts of angles, and everywhere we look, and trying to make this a community project where we even come up with the ideas like, hey, kids, what are you doing to be more hygienic and observe social distance? What are the ways you've been doing this? Say, oh, kids are doing this, right? And having, oh, we've polled a bunch of kids, right? Polled a bunch of university students, polled a bunch of, you know, elderly, right? What are ways that they're doing things? And getting ideas that way, because I think then it creates these norms that everyone's doing it, so why am I not, right? The fear of not being part of the herd. Yeah, and fear of missing out. Absolutely.
Yeah. And to that point, I just have one question that I think everybody in the audience and otherwise would be able to relate to. So these are macro kind of implications, things we can do at a macro level. But thinking of it on a micro perspective, for instance, in a situation where I want to ensure that my family doesn't spread misinformation on WhatsApp. Now, they don't understand behavioral science. What can I do as one person to kind of help them understand why they shouldn't be sending out information without cross-checking the facts, and kind of discouraging the wider family group or the wider participants in a group as well? If everybody could share like one thing that they think people should do to help their family members or relatives or friends curb this spread of misinformation, especially on platforms like WhatsApp, from a behavioral science perspective.
I think we've talked about empathy here, and I think the first principle that I would kind of adopt is to have empathy in this situation. You know, there is misinformation because people are scared and people are anxious and they're worried and confused, and so to approach this with empathy when messaging back as well, and to meet misinformation with the right information, right? Where possible, find those articles, find the evidence that you can, and kind of meet information with that. Those are the kind of things that come to mind.
Mm-hmm.
I think I would suggest, as a general idea, encouraging, as we say, system 2 thinking. Try and encourage people to be very deliberative before they send something out. One of the things that jumped at me, I'm not quite sure if I've got the number right, but it was something like, for every one infection that someone prevented, say a couple weeks ago, they were avoiding 2,600 in the future, or something like that. I'm not sure I've got the data right. But that idea that, you know, every little thing done early on has a huge difference later on. Getting that, having everyone understand that and beginning to be very mindful of what they do. is really important, including, going back to the last question about the young people, who I think there was unfortunately an emphasis on, the safety, of young people and the sort of almost invulnerability of young people early on. But of course, if the virus spreads, you go to a lockdown, jobs aren't available, and who suffers the most often? It's younger people who get shut out of the out of the labor market. So I think that getting people to just think through a little bit more deliberatively, mechanistically, like what's actually at stake, and slowing things down might be a general principle here.
Just to add to that, I think this has become a very binary kind of messaging, thanks to all this data on case fatality rate, right? So if we move to saying what are the other risks, right? Risk of hospitalization, unemployment, missing out on school, missing out on even something like, say, sports activity, right? So there are a lot of other downsides to this, which may be much more appealing for specific populations.
One thing I will say is that, I think I'm going to give two quick answers to this. So first of all, I think whenever we can, as responsible individuals, even if we're in control of social media, the different algorithms used, I think one intervention is to ensure that some of these, the spread of misinformation and like low quality sources, I would say, is kind of down regulated and it's not as prevalent. So I think that's one thing, but that's more higher level. But I think there was a research study done by Gordon Pennycook, and it was published in the Proceedings of the National Academy of Sciences. Surprisingly, lay people, we say surprisingly, but this is a wisdom of crowd sort of thing. Lay individuals, all of us, right? We're pretty good at judging the quality of content, right? And we're pretty accurate. And so I think, and there was a question I saw about memes serving to be useful in disseminating information. I think there's definitely a lot of misinformation, and some of that is coming in the form of certain memes, right? And so I think then we could have polls that say, just like we just did here, right? Or even in the news, right? Okay, how many think that this is actually credible? And then promoting the fact that that's actually a very small population that thinks that this is credible, and then saying, hey, this is not credible, and saying, oh, there's misinformation here. And so then that promotes more high quality, more reliable, more system 2 type information. And then I do think that there is something to be said, though, about the aspect that some of this misinformation, it's really because it's in the form of some of these memes, or it's in the form of easy to understand content, right? And in certain ways, there's many other reasons for it too, but then reversing that and actually getting the good content, the high quality content, to be also simplified, also easy to understand in that bite-size form, right? That makes it easily to digest and remember. And that's why I created this terrible rhyme, of course, and they're much more clever folks than I am. But that's where I think that we could use help, right? And ask the clever folks, okay, what campaigns can we run? What maybe jingles that we can have so that we can air this to make it the prevalent, the good information, the trustworthy information more accessible.
Great. On that note, I think we're running a couple of minutes late, so I'm going to quickly wrap up. Thank you so much for participating in this webinar and taking the time out. I think we've had a really, really interesting conversation. And it's fair to say, I don't think we're going to stop here. We're going to try and do a lot more webinars to kind of continue this conversation. And as Sana mentioned, maybe put a group together who can work with this and do more research on it. So please do get in touch if you have any ideas for collaborations. And just in general, I hope you had a good time, and I hope all our attendees had a good time as well. Thank you again, Vihara, for being the knowledge partner, and all my colleagues as well, Jafar, Junafi, and Devyani. Thanks a lot.
Thank you guys. Thank you so much for inviting us and organizing this wonderful panel. I learned so much from everyone. Thank you.
Glad, really glad. Thank you. Thanks a lot.